el spoiler alert es que no se trata ya de una batalla entre la educación online versus la educación presencial. Estos nuevos tiempos llaman por un modelo híbrido más complementario. En fin, las sesiones han sido súper interesantes y si por alguna razón no pudieron acompañarnos, ya saben que pueden ir a la agenda y van a encontrar todas las grabaciones para las sesiones de todos los días. Como saben, nuestra sesión de hoy se titula Telemedicina, reconectando a pacientes y servicios de salud después y durante la crisis. Nuestra sesión de hoy tendrá dos partes. La primera parte va a ser un Future Flash o vistazo al futuro sobre lo que se viene para telemedicina, especialmente a raíz del contexto actual. Esta primera parte se llevará a cabo en inglés. La segunda parte será un panel en el que nos acompañarán Máximo Manzi, director ejecutivo de ProMed de Costa Rica, Erwin Padinger, presidente de Meditar de Argentina, y Alejandro Vega, presidente y CEO de O2LAC, también en Costa Rica. Ahí habrá una mezcla entre español e inglés. El día de hoy los invitamos a que compartan sus preguntas en el chat. Hemos tenido unas conversaciones súper amenas y súper divertidas, así que compartan sus preguntas y nosotros las iremos revisando y al final, si nos da tiempo, compartiremos algunas con el moderador para que pueda compartirlas con los panelistas. Now let me quickly change to English for a moment to introduce our first speaker. Aaron Orr is the founder of XRHealth, a first-of-its-kind VR telehealth company providing remote monitoring and telemedicine using proprietary technology that helps clinicians better manage their patients' healthcare via specialized extended reality, or XR, technology solutions and data analysis. Aaron founded XRHealth after experiencing a long injury rehabilitation process himself and becoming convinced that virtual reality would change healthcare as we know it. Aaron, thank you for joining us today. You have the floor.
Thank you, and hi everyone. It's a pleasure to be here. I think we are in a unique point in time that this presentation is more relevant than ever. I'll start by introducing myself before I'll dive into the company. As you can hear from my accent, I'm not originally from the US. I'm an Israeli, and I served as a F-16 pilot for 16 years. And then I was diagnosed suffering from whiplash due to the active flight. And during my own rehab, the idea came about to combine VR and rehab. That's how we got started. And in the last basically 4 years, we developed different types of applications, which I'll show you in a sec. But we focused mainly on selling the technology to hospitals and rehab centers. And basically 7 months ago, as part of one of the rollouts that we did here in the US with one of the big insurance companies, we tested all the usage of the technology back home. And we realized that the potential back home is completely, it's far greater than in the hospital. And then basically we geared up and became a VR telehealth clinic, and we opened the clinic March 1st. And 2 weeks after, COVID hit, and since then we are basically scrambling. The general idea, which again I'll dive in a sec, is that telehealth is a broad options of possibilities where you can basically use only 2D in order to basically provide good healthcare services. And we believe that the combination of telehealth and VR AR, that's the future of telehealth. And now I'll dive in, and in the next 10 minutes, I'll talk a little bit about the market, the potential, and what are we doing here at XRHealth. So this is a snapshot of the telemedicine market growth before COVID. And it was obvious, I think, for all players, is that people preferred to get their healthcare services from the comfort of their home. And basically, COVID just accelerated everything. And basically, what we thought will take 5 years happened in a month. regarding the adoption and the willingness to be open-minded for the different types of telehealth services that you can actually use from the comfort of your home. And again, it's across the board, obviously from primary care, but all the way to mental health. And basically, as you will see in a sec, we believe that the entire outpatient concept can be completely, can basically, we can turn the entire outpatient or the vast majority of the outpatient sequences and treatments to home care by using and leveraging different types of technologies. So a little bit about us. We are a registered medical provider in across the US, 50 states, 500 clinicians already today. And we are using our own proprietary software, that VR software that we developed in the last 4 years. And we will expand to AR later on. At the moment, the AR devices are not good enough in our view. All our applications are FDA registered, FDA Class 2. And besides that, we have all the ISO certification and HIPAA compliant platforms. And basically, when you're using VR as a telehealth tool, it opens up a whole new spectrum of possibilities, because VR, and when I'm saying VR, I'm referring to VR AR. Basically, the system or that entire technology provide 2 or 3 major benefits that no other technology can bring to the table. The first one, which is the straightforward one, it's very immersive. And I'm assuming you saw people getting very excited or very anxious, because we can basically hijack the brain while someone is within the VR. We believe we can hijack the brain to treat the body. And using different types of techniques like cognitive behavioral therapy, or mindfulness, or different type of techniques to basically again harness the power of brain plasticity in order to treat the body. So that's one element which is very powerful in this technology. The second part is that everything is, you can quantify everything the person is doing within the VR environment. So once someone is putting a VR headset on, they are basically becoming an element in a computer generated environment. And that basically allows us to capture and analyze all the things that they are doing inside that environment. And we can manipulate the environment and see how they react to that change. And we believe it will allow us to quantify processes in a way that till now was basically impossible to quantify. And the last part, which is maybe the important one for this type of conversation and webinar, is that location is meaningless. We don't care where the patient is physically. All we care is that he will be inside the virtual reality environment. And those 3 elements, again, are very powerful, were being combined together. So currently, we have different applications in those verticals that you see on the screen: motor application, cognitive, pain management, and hot flashes, and even support groups in virtual reality. And we are measuring different types of elements while the patient is inside the VR. Basically, our platform is a combination of the different types of elements. So the VR is just one of them, but each and every clinician have the ability to control basically the patient VR headset completely remotely, and basically conduct virtual reality treatment completely remotely from any PC or a Mac device, which basically puts them in the same, again, virtual reality environment and conduct those treatments while the patient is playing games and having fun. We try to have different type of environments that are basically exciting for the patient. And after every session the patient is doing, there are complete analytics and data coming out of the system, allows the clinician and the patient to actually see if they're getting better or not. And again, everything is recorded in a HIPAA compliant way, so the patient and the clinician can see progress over time, and if needed, to change the protocols or to adjust the entire treatment plan. What we are starting to see from the rollouts that we are doing is that we have, we believe, we have better outcomes than a brick and mortar clinic. And we have different types of assumptions why that's happening, but assuming that we are correct, and not just we can provide a better experience, an engaging experience for the patient, and ease of use and improve access to the clinician, we believe that we can also reduce cost for everyone in the entire healthcare system. And again, we are seeing that across the board. So here we put some different examples here, but the time for recovery is relatively impressive and quicker than we expected. So I'll dive into some applications so you'll see some pictures and see how it looks like. This is an example of our cervical spine application. This is actually the first app that we developed. Basically, it's targeted toward people that are suffering from whiplash or cervical spine herniation or any type of neck injuries. And basically, the patient himself is playing a game. In this game, the patient's job is to protect the dragon, as you can see in the picture. And he's protecting the dragon just by staring at the dragon and creating that shield around him. But the dragon basically is flying all over the place. That's up for the clinician to decide where he wants the dragon to fly and in what speed and the angles. And basically, while the patient is playing the game and protecting the dragon, they're actually doing their rehab process. And while doing that, we are measuring their speed, accuracy, response time, smoothness of the motion, range of motion. And again, that allows the clinician to then evaluate and see if the patient is getting better. Second example is a balloon blast. Basically, in this scenario, the patient is within a circus, is holding two swords, and it basically just need to pop balloons. Now, again, the clinician is the one deciding the location of the balloons and the entire sequence of where the balloons are popping up. And we are asking the patient to pop the balloons in a different manner. And while they're popping those balloons, we are measuring their success rate, their response time, smoothness, efficacy. This app is more targeted toward the upper extremity, rotator cuff injury, and different types of upper extremity applications. This app is more for cognitive decline, ADHD, and other type of mild cognitive issues. It's basically a very simple game. You have two boxing gloves in your hands. They are switching colors constantly, and all you need to do is to punch the right light according to the color of the glove. And again, while doing that, and again, the clinician can monitor and change everything. And while doing that, you are basically, we are capturing all your information, if you are impulsive or not, if you are not able to react fast enough, if you have any issues with your coordination. And so again, that also provides us with a holistic picture about the patient status. A simple memory app, but again, just to emphasize the difference between 2D interface and a 3D interface. So in a 2D interface, when you're doing different types of memory skills tasks, it's very hard to know what was the sequence all the way to making that decision. In VR, we can capture everything. We can see if the reason was that the patient was distracted, if he hesitated. We can see the entire sequence of thoughts and again, the amount of data that we can capture from a single simple test is in a magnitude better than in a 2D interface. Other applications are more on the cognitive behavioral side. So this is an example of a hot flash cognitive behavioral therapy application. This one is targeted more for women in menopause or after suffering from hot flashes because of a chemotherapy. And here we're using different types of techniques. Here we are basically, and circling back to what I said previously, we are hijacking the brain to treat the body. We are basically transporting the patient to a cold environment, icy environment, and basically teaching them how to breathe in a cold environment. And we are seeing amazing results with this specific app. We conducted initial clinical trial with 34 patients that had hot flashes because of chemotherapy. They used our application twice a day for a time period of 6 weeks. And we had better result than any drug in the market in that specific clinical trial. We are now gearing up for a larger clinical trial. But we believe that this vertical of cognitive behavioral therapy and the combination of cognitive behavioral therapy and VR will be a game changer for the industry. Another field which is, I think, the most researched one in the VR space is pain management. VR already showed tremendous success in the pain management field. There is a debate in the industry what causing that, and whether it's a specific application or just the concept of VR as a distraction tool. But also here we are seeing amazing results. Here in the US with all the opioid crisis, that's a very big thing to have a non-pharmaceutical solution for pain management. And we believe that we're just scrapping the surface. And again, that mindset is another pain management and stress relief. Again, similar to what I mentioned previously. Last example is the support groups, which what we are seeing today, especially with the COVID and the isolation that people are experiencing, there's something unique in VR, in a social experience within the VR environment, is that you are actually feeling that you are in the same room with that person, even though it's an avatar, but it's just completely different than a 2D interface. And we launched support groups in VR basically a month ago, and at the moment it's probably one of the most attractive applications because I'm assuming a lot of the COVID scenarios. But I think that's an example of a technology that can solve immediate need and problem within the market. And isolation, especially for the elderly population during COVID, is a major problem. And we believe VR could, to a certain extent, can help alleviate that tension and problem and isolation. Basically, just so you understand better how the flow looks like, so a patient can just sign up, and then we are doing a video call with one of our clinicians. Then we are shipping them a headset, and they're downloading a mobile app that guides them how to use the VR headset. And from that point on, the clinician and the patient are scheduling treatments like brick and mortar clinic and conducting virtual reality treatments completely remotely, according to what I showed you previously. I'll just, the last couple of slides, because I ran out of time. What we are seeing from the patient point of view is tremendous acceptance to use this technology. Besides the health outcomes, I think patients are seeing the value of getting treated remotely and quantifying their performance. We have patients that are telling us that they will never go back to a brick and mortar clinic. I'm not sure that's the case because we can't replace all the sequences, but I'm pretty confident that VR telehealth can replace a lot of the standard brick and mortar clinic, and that's what we'll see in the next years to come. Again, you can, I'll skip directly to the patient testimonials, but as you can see, again, those are just several examples. We have a lot more of those. That's basically it. And I'll hand it off now to the panel. Thank you.
Thank you so much, Aaron, for that super interesting presentation. Ahora le doy pie a nuestro panel. Estimados Máximo, Alejandro y Erwin, bienvenidos. Máximo, tienes la palabra.
Muchas gracias, Isel. Muchas gracias al BID, al Banco Interamericano de Desarrollo, por la invitación. Y bueno, gracias a Aaron, nos ha permitido entrar un poco en el tema. Déjenme primero que todo presentar a los otros panelistas que nos acompañan el día de hoy. Ya hemos escuchado las credenciales de Aaron. Tenemos también en ese panel a Erwin Padinger. Erwin es una personalidad reconocida en el área de la salud y servicios médicos. Su carrera profesional en ese ámbito empezó en 1985 en la Junta Directiva de ISARA, que es el Instituto de Servicios Sociales de Trabajadores Rurales en Argentina. Y en el 1991, Erwin fundó Meditar y ahora cumplen 29 años de operación. Y justamente el año pasado, en el 2019, Meditar, una empresa dedicada a la prestación de servicios de medicina de alta complejidad, generó Telemeditar, un sistema innovador de consulta médica virtual. También nos acompaña Alejandro Vega. Alejandro es el fundador, el CEO de Juli, una empresa startup de salud digital basada en varios países de Latinoamérica. Es graduado de la Universidad de Pennsylvania, donde ha obtenido su MBA a la Wharton School, y también es un fellow del Lauder Institute Global MBA Program y un alumno de su programa internacional en portugués. Quisiera, para empezar la conversación con nuestros panelistas, mencionar a los asistentes que vamos a seguir dos enfoques en ese panel. Por supuesto, cómo la telemedicina ha sido adoptado como una de las respuestas a los retos en cuanto al acceso a servicios de salud durante esta pandemia COVID-19, pero también, y ese es el foco histórico del Outsource to LAC, cómo la telemedicina o la prestación de servicios de salud a distancia puede ser una oportunidad de internacionalización, de comercio internacional de servicios, como Latinoamérica puede ser una plataforma, un proveedor de servicio de ese tipo para el mundo, incluso prestación de un país a otro en nuestra región. Algunas cifras ya nos ayudaba un poco a dimensionar. Déjenme agregar nada más, según las cifras del Global Market Insights, hablamos que para el 2019 esta industria generaba 45.000 millones de dólares y se espera un crecimiento de un 19.3% anual de aquí al 2026, donde se espera que esta industria puede llegar a generar unos 175.000 millones de dólares. Entramos entonces al panel. Me gustaría empezar con Alejandro. Alejandro, por favor, ¿por qué no nos cuentas un poco de Juli, qué están haciendo y sobre todo cómo se han ido adaptando a los desafíos que nos ha presentado la pandemia por COVID-19? Muchas gracias.
Hola, bueno, gracias Máximo y hola a todo el mundo. Espero que todos estén bien. Bueno, Juli es una empresa de software. Nos enfocamos en salud digital. Ofrecemos software de agenda electrónica, expediente electrónico y telemedicina, o sea, como un practice management software con EHR. Estamos desde México, todo Centroamérica, y también tenemos clientes en el Caribe. Tenemos más de 10.000 centros médicos, doctores, hospitales, clientes nuestros en la región. Y nada, hemos venido creciendo bastante bien en los últimos años. Con respecto a la pregunta de Máximo, que cómo hemos lidiado con la situación del COVID, para nosotros ha sido interesante dentro de la empresa como tal, como muchos de ustedes, es adaptarse al tema de teletrabajo, que hemos visto que eso conlleva sus challenges, pero a la vez nos ha ayudado como empresa, creo que enfocarnos más, que ha sido algo positivo. Y ya más hacia el mercado, uno de los challenges que hemos visto es que nuestros mismos doctores, dependiendo del mercado que estamos, han sido perjudicados de diferentes maneras. En algunos han cerrado Ministerio de Salud o algunos gobiernos cerrado la consulta externa. Entonces, aunque le ha afectado a nuestros clientes, nos ha abierto la oportunidad de explorar más el tema de telemedicina e impulsarlo en estos diferentes países. Entonces, en general, ha sido algo bastante interesante y muy movido en los últimos meses, definitivamente.
Perfecto, gracias Alejandro. Entonces, pasamos de Costa Rica a Argentina. Erwin, también, ¿por qué no nos cuentas un poco de telemeditar y también cómo han ido enfrentando esos nuevos retos de acceso a la salud, a los pacientes que ustedes atienden y cómo han resuelto esta situación por medio de